Good afternoon, everyone. It's Dr. Tom Warcup from the Block Island Medical Center. Today is Monday, April 11th. I have a brief update to you on the fourth vaccination recommendations, as well as our testing information on the island and some regional and state COVID numbers. Let's start with the COVID numbers. Our state continues to see a rise in our COVID number, new cases. We were all the way down to 101 cases per 100,000 people, and now we've drifted up to 191 per 100,000 cases. So we've seen a slight rise over the last several weeks. We're still significantly better than where we were 5 to 6 months ago. Hospitalizations continue to be very low. We're actually lower this week as compared to last week. And we have our positivity rate has gone up to about 4.4%, which is similar to what we had in February. So stay tuned on more data and continue to practice safe distancing. The state continues to be very successful with vaccinations. We have 825,000 Rhode Islanders that have completed their primary series and more than 950,000 that have been partially vaccinated. So congratulations to those that have been vaccinated. And some of the guidance on the fourth vaccinations have come out with the New England Journal of Medicine that was just published last week on April 6th. I'll read to you some of the conclusions of that study. That a fourth dose of the vaccine does increase your neutralizing antibodies by a factor of 9 or 10 as compared to the way you are prior to the vaccine. But this is something we also experienced after the third vaccine, that you get a very sharp rise in your antibody neutralizing ability, but then it drifts back down to a more stable, what they call humoral immunity, which is how our bodies are built to receive vaccines. The fourth dose did not lead to substantial adverse effects, despite triggering mild symptoms in almost every subject. Pfizer and Moderna have shown similar efficacy for the prevention of symptomatic disease. The study estimates that the vaccine efficacy against symptomatic disease is 65% at most. So that might be a shockingly low number compared to what we thought from earlier data. The study also states that the third dose of the mRNA vaccine achieves the maximal immune response. So you will get an increased neutralizing antibody for a 12-week period if you were to get a fourth dose, but your overall immune system is as maximally prepared after the third dose. So the overall conclusion from the New England Journal of Medicine's article was that a fourth vaccination of a healthy person may have only marginal benefits, and the older and the vulnerable populations were not assessed in this particular study. Now, there have been some further recommendation to augment the study, and I would agree that those individuals over 70 years of age get a booster. I'd also validate that if you're over 60 years of age and have chronic medical conditions such as diabetes, emphysema, COPD, asthma, etc., that I would also go ahead and get that fourth dose, or at least strongly urge you to consider it. The medical center in the town is working with our Rhode Island DOH representatives and liaisons about future vaccinations and testing on the island, and we'll get those communications out as soon as I understand them. Many of you recall that the state's testing apparatus has sundowned at the fire barn, and Tracy and Linda had continued it for some period of time on Tuesdays. We're in communication with the Department of Health this week about an ongoing testing strategy for the island. It'll likely be a combination of some face-to-face availability, but if not bulk home testing equipment that we would give out, similar that we have in the past. So if you feel like you may have been exposed or that you would like to have some testing devices at the house, we'll be having regular events to pass out those free testing kits. So please enjoy today. Today is a very sunny day. Get out and walk on the trails. As soon as I get updated information, I'll get it out to you, and have a wonderful day.